I totally forgot. Starting. Good evening, everyone. I'm Varsha Kadale, sports physiotherapist. So today we'll be having exam prep session for exercise therapy. Before going in detail, I would like to tell few things, few tips before starting or sharing any question paper or any particular questions. So first thing is, I want everyone to keep in their mind, exercise therapy is a very lengthy paper. Even though you know all the answers, exercise therapy is kind of very lengthy. So in this session, I'll try to make sure I'm covering what and how your presentation should be. Going to the next slide. You will be having overall like 2 plus 8, 10 plus 10, 20 questions you need to be attending first. So each question, each essay question is of 10 marks. Short notes is of 5 marks, and VSAQs or brief notes are for 2 marks each. Whenever an examiner is correcting the paper, we'll be checking for perfection first in the starting few papers. Hence, my suggestion or one tip is start writing paper with VSAQs first. Only if you are confident about it. For example, you are having, these are the brief notes. You are having 10 different questions here. So whenever you go check the question paper, all these 10 questions, you might not know it. So complications of bed rest is the first question. Lower limb length measurement is the second. Like that, we are having all 10 different questions. If you know, for example, these breathing exercises answer very much perfectly than the first question, try to attempt breathing exercises first. Most of the students, one mistake they'll be doing this, once they start attempting the paper, they take 1 hour for one essay answer. After completion of 1 hour, they realize that they did too much of mistake attempting it. So what happens is, while writing the essay question, they'll be gaining, even if you give 200% for your long answer or essay question, you'll be gaining only maximum is 8 marks. But in VSAQs or brief notes, one thing is, even if you attempt, the examiner will be trying to give at least 1 mark for the question. So 1 mark, 10 marks you will be you will be achieving by writing VSAQs. And as it is exercise therapy paper, I'm not talking any other subject. As it is exercise therapy paper, I would like to tell this thing: go for stick diagrams or line diagrams. So if you want, for example, we are talking about relaxation. If you want to show the relaxation technique, there is no need that you have to be an artist here. Simply go start drawing a basic ray diagram or stick diagram. In most of the cases, ray diagrams will do your work. There are few questions such as Hubbard tank here. So in this Hubbard tank, the examiner will be expecting you to draw the entire figure of the Hubbard tank. Not to the perfection, but at least just to know whether you are having any idea or not. At the same time, there is no need for you to talk or draw anything for PNF here. Because even if you want to draw, you can draw on the basic procedures and techniques. Apart from that, there is no need for you to show ray diagram here. Again, while writing exam, you should be clear where you have to invest how much time and at what time you are writing the exam. So, for example, you started with VSAQs. You completed all these questions in a half an hour time. Mostly, you'll be writing this within a span of 15 to 30 minutes. Here I'm talking about the students who depend on what they learned and come. I'm not talking about the students who depend on what their friends learn and come. So I have seen mostly students, they write VSAQs at the end because they think last moment help might be necessary. Hence, they won't start writing this. And minimum, you have to cover at least half of the page while writing for VSAQs. Complications of bed rest, even if you're writing 1, 2, 3, or even 10, make sure you are writing in a bullet form. Next is lower limb length measurement. Here, lower limb length measurement, you will be checking both in supine line and in side and in standing as well. So when you are writing this, you will be again writing about shoes on and shoes off assessment as well. In this answer, even if you are not drawing any diagram for lower limb length measurement, it is perfectly fine. But again, coming to this answer, springs in series and parallel, most of the students, they just leave the physics part both in biomechanics and exercise therapy. Almost you will be leaving springs in series and parallel, Delorme's boot, pulleys, Hooke's law. You will be thinking like someone might help, or I don't want to invest my time reading that. In questions like this, I will again suggest only drawings if you don't know anything. Even in Hooke's law, you can draw, even in pulleys, you can draw, even in springs in series and parallel also, you can draw. Now, let me start with essay questions. This is a model paper Prakara has chose just to display how the question paper will be coming. So, SAQs, there'll be first, you need to attempt 2 questions, but 4 questions will be given. Explain types and techniques of suspension therapy to lower limb, or describe principles, indications, and techniques of relaxation. This is first question in for 1A or 1B. And as you all know, you being more worried, you tend to write the number wrong, the question number wrong, or sometimes you will be just keeping 1. You will not write A or B. Just make sure you are mentioning that correctly. And let us go to how a map of how you will be attempting the suspension therapy to lower limb. So any question related to suspension therapy is coming. First, start with definition. Here, one suggestion again I would like to give is don't try to change definition. Okay, if you are not able to remember, write at least a part of the definition, but don't change the definition from one form of English to other form of English. You maintaining the definition correctly is kind of respect you give to the person who gave that definition. Next, coming to the principles. This is what, as an examiner, I have shown you here. Next, coming to equipment. What are the equipments you will be using? You will be writing all the frame, pulleys, slings. Even you can talk about the clips as well. Coming to the types here, irrespective of, again, suspension therapy in this question paper is asked for SAQ question. It is for 10 marks question. Hence, this definition, principles, equipments, types, and techniques are necessary. Technique depend on what question directly they asked. Let us go back again to the question paper. Here, they have asked only for types and techniques of suspension therapy to lower limb. What will happen if I am not writing the definition and principles? First thing, it is kind of like direct hit to the answer. Whatever is asked, you will be directly talking about it. That is the thing which we generally don't prefer. But if you don't know the definition, skip the definition. But if you are writing the definition, it will be very good if you are writing the exact definition. And a few students, again, depends on your interest, even write the definition was given by so and so person. Once that is done, definition and principles of suspension is done. Directly going to equipment, again, it depends on your interest. But here I have shown equipment because most of the students can't draw the suspension therapy diagrams that easily. They get confused while drawing, because you have to draw a frame there, you have to draw a therapist, you have to draw sling, you have to draw everything, the patient sleeping, sideline position and all. If you feel that is not possible for you, hence equipment will give a kind of, instead of describing the equipment, simply draw the equipment. Drawing the equipment is much easier than writing about it. Where while technique, only keep the side headings. For example, lower limb, you will be writing about hip flexion, hip extension. You'll be writing about hip abduction and adduction. You'll be writing about hip medial rotation and lateral rotation, knee flexion and extension, ankle plantar flexion, dorsiflexion, inversion and eversion. So you have to, in short, describe all the 6 movements. In these 6 movements, writing about the movements will only be difficult. Now, if you are concentrating only on drawing at the techniques, it doesn't fetch you marks and it will eat more of your time. Again, I am repeating, as it is 10 marks question, I have written all this. But if the same question, explain types and techniques of suspension therapy to lower limb, is asked for 5 marks. For 5 marks question, there is no need to write any introduction. But if you feel you are having time and you don't know other answers, you can directly start going with the same procedure. This is about suspension therapy. The next question is, describe principles, indications, and techniques of relaxation. Again, go with the definition if you want. Here I have not included the definition part because generally relaxation definition is not same in most of the books. Once you open Dina Gardner, you will be finding some other definition of relaxation. In Lakshmi Narayana, you will be finding some other definition. In Kistner, you will be finding some other definition only. Hence, I have not involved the definition part because examiners come from different universities and all. So you can't imagine yourself sitting and studying all the definitions from all different books. Hence, definition is considered, you can leave definition, but if you are confident that you know the definition correctly, I would suggest write the author's name from which book you are writing at least. So that will fetch you more marks or kind of having impression, the examiner will have a good impression on that particular student. Next comes to indications. See, again, exercise therapy, low frequency, high frequency. Even if you don't know the answer, principles, indications, contraindications will cover up more pages. So at least the examiner will be thinking, okay, he knows something. Before going in detail, I would like to add one simple example. I don't know how many of you know about this. There is one thing called cow composition. So when I was in something around 5th class, my teacher came and told like, even if you don't know anything, remember cow composition as an example. Everyone thought it is something related to cow, but that example is related to a boy where tomorrow there was a seminar kind of thing, but that seminar topics were not disclosed until tomorrow. They were given like something around 10 to 12 different topics, and the task of each and every student there is you have to learn about each and every topic and come. There were many topics like aeroplane, house, cow, bike, car, and all. So this guy wanted to do some kind of smart work. So he started reading only about cow. So he is very much perfect in cow composition. His composition of cow is an animal. It might be in brown color or white color. It has got 4 different legs. It gives us milk. It eats grass and all. So like that, 10 points for that cow composition, he has read completely. Now, the other day when he went to the school, in his chip, in the topic disclosed there was house, but he has learned about cow. So he started talking about house, like there is a house has got walls around. Again, in house there is a door. Beside the door there is a window. If I see from the window, I see a cow. And he again starts narrating the entire cow composition. The teacher got she was not happy. She gave some other topic to talk. The other topic is car. This boy again started telling, my car is parked where the cattle will be there, and there is a cow again. So this is not the cow composition is just a example for what you will be doing in exam. I know most of the students know this technique already. Here there are few questions, even in relaxation as well. I'm saying, even if you don't know any indications of relaxation, you can directly start writing why exercise therapy is indicated. This will fetch you more marks. So once you start doing this, writing exam is much easier. Here I'm nowhere telling you what is relaxation, what is suspension therapy, what is PNF and all. Here I'm just telling you today how to write an exam. So whenever a lengthy paper is given, or if you missed any topic and those topics are only coming in exam, one thing I would prefer here is directly go start writing. Don't waste your time thinking what to write. As you start writing, you will have many points striking your mind. Maybe there are few students who will be studying like 24/7, but at the time of the exam, because of they being anxious, they can't put whatever they have read, because of which they'll be ending up having less marks. For those students, whatever I'm telling now will be very much useful. Again, coming to the procedure, even in relaxation, you have to write in which procedure you are talking about. If you are talking about general relaxation or local relaxation, if you're talking about again general relaxation, you have to talk in which position: supine lying, prone lying, side lying, sitting. And if you're talking about local relaxation, what? You have to talk about few asanas as well. And there are many other techniques of relaxation as well, which you have to mention. And the question here asked is about the relaxation. It is just not asked about one particular type. Coming to the next question, this is second A. In second question, either you have to write about re-education or goniometry. So coming back to describe re-education of the muscles. In re-education of the muscles, you can directly follow Dina Gardner. If most of the times I have seen re-education is kind of very difficult question for most of the students, because there is no direct note for it. For topics like this, just remember re-education of muscles indications. So when you will be giving re-education to the particular muscle, when a muscle is forgetting its own action. Per se, I had a glass cut injury on my elbow. So as I had injury to my elbow, my forearm flexors has been undergone surgery, and they have taken graft from my extensor aspect. For the flexor aspect, they have taken graft from the extensor aspect, and the surgery is done. So after the surgery, I'll be having a scar over here and here. I'm having scar over the anterior aspect and the posterior aspect. Once this is done, I'll be given a cast, rest period, immobilization phase. My hand will be left like this. Even a slight movement of wrist extension will cause stretch over the scar over here. Even a slight movement of wrist flexion will cause slight stretch over here. Hence, what we do, we ask the patient to leave it like that. Stay in this position without moving even the wrist. Even slight movement of fingers will cause contraction over here, which is not soothing sensation for the patient. The patient feels as if the skin is tearing again. Hence, because of that fear, most of the patient tends to keep their hands like this only, with wrist in neutral position, fingers in neutral position. And our body is not meant for immobilization. There are many cases where immobilization for 1 week itself, you will be seeing quadriceps inhibition. Hence, we tend to ask the patients to keep doing at least minimum movements, and the first exercise we start is isometrics. So here, in cases like this, immobilization is must. So what we can do here? The patient is coming to you after two months. So after 2 months, if the patient is coming, first, without even checking, most of the physios think the muscles, the MMT of the extensors is between 0 to 1. This is also 0 to 1. Mostly it won't be 0 to 1. It might be somewhere between grade 2 to 3. Here, after I am taking graft of the extensor compartment and keeping in the flexor compartment, it's like I am teaching one group of muscle to act like other. So you people joined BIPC in your intermediate. After joining BIPC, you took a course BPT. Now, after studying for 4 years of BPT, I am asking you people to do digital marketing, which is something related to engineers. After taking MPC, you will be understanding that. It is very difficult for you to understand how to do digital marketing. The same confusion will be over here. All these days, whatever the muscles were doing this action, I am asking them to do this action. For the muscles which were doing wrist extension, I am asking them to do wrist flexion now. Is it easier? No. That is the first case. In second case, after too much of rest, after too much of complete immobilization, even flexors will be forgetting what they have to do. The same case, every time the teacher comes to your class and asks what we have read yesterday, 90% of the class will forget what was taught yesterday or what was discussed yesterday. Nothing but re-education. I will be re-educating myself again from the basics. For example, anatomy, not only me, most of the people will be having kind of a revision to their self of entire anatomy, just to remember all the muscles. That is nothing but I'm re-educating myself. So this entire re-education of muscles, you can write in your own words. You can use the example which I gave, but irrespective of whatever it is, first start with this MMT grading. At least at the end of the answer, if this grading is there, it will give the examiner idea that you know something or something about the re-education of muscles. So if the patient is coming to you at a stage where the muscle strength is at 0 or somewhere between 0 to 1, what you will be doing? If the patient is coming to you at this stage 0 to 1, in exercise therapy, you will be giving passive movements. 1 to 2, you might go to passive movements, assisted movements. 2 to 3, you will be directly going with active, again, active assisted. If the patient is not able to do active, don't force for active. If the patient is able to do active, go for active assisted. 3 to 4, you can add resisted movements. 4 to 5, again resisted movements. These, see, here I told passive, assisted, for 1 to 2 assisted, 2 to 3 I told active, 3 to 4 resisted, resisted, 4 to 5 also resisted you can go. Like that, there are many other treatments in exercise therapy. Hydrotherapy. Hydrotherapy you can use from grade 0 to 1 till 4 to 5 just to increase the strength. There is other treatment, suspension therapy. Suspension therapy, there is no need for you to use after grade 3 to 4. You can use only till grade 2 to 3. Again, coming to PNF. PNF from 0 to 1, grade 0 to 1 till 4 to 5, you can use all those. So if you know all the other techniques, forget about re-education of muscles. If you know the entire syllabus except re-education of muscles, you can answer this entire question. Only writing about one grade will take something around 2 to 3 papers. So imagine writing about all the papers, all the grades, you will be actually covering more than 10 marks question. Lastly, if you want, few students may write about even the protocols which we give for resisted exercises. Only if you are confident. Cow composition will be working only if you are confident and perfect about that particular answer. You want to write about PRE, you want to write about DeLong's protocol, but you are not perfect about it, don't write it. Don't mention about it. This is about re-education of muscle. The third essay question. Fourth essay question is goniometry. Oh, I'm so sorry. Here, in this question, it was even asked about spatial summation and temporal summation. Mostly, here in the question paper, you will be given in the brackets 2 plus 8, 2 plus 4 plus 4, 4 plus 3 plus 3. So here, explain types. For types, it is 2 marks. For techniques, it is 8 marks. For principles, it is 2 marks. Indications of relaxation, it is 4 marks. Techniques of relaxation, it is 4 marks. Again, for re-education of muscles, it is 4 marks. Spatial summation, 3 marks. Temporal summation, 3 marks. Depending on these division, you can write. I have actually kept the other slides depending on this division only. Again, in goniometry also, in detail about goniometry, you will be writing about the device. Definitely, if you're talking about any device, I would suggest you to draw about that goniometer as well. And measurement of range of motion of hip joint movements. Mostly, one thing I have seen in goniometry answers are, they will write about the procedure, they'll forget mentioning the ROM. So just to avoid confusion or thinking ki, how to mention those ranges and all, in hip, for example, if I'm talking about hip joint, I have got flexion, extension, adduction, abduction, medial rotation, and lateral rotation. Draw a tabular form and write hip movements and active range and passive range. About how much is required. For example, hip flexion with knee flexion, it is 120 degrees. With knee extension, it is 90 degrees. You will be writing that in a tabular form. Once that is written, then write the procedure. Not only for hip, any joint asked. Even if shoulder is asked, even if elbow is asked, wrist is asked, first write movement, then write the range, then start the procedure. In procedure, you will be writing position of patient, position of therapist, procedure again for each movement. If you feel writing that in a paragraph is creating more and more disturbance, simply write that in a tabular form again. Position of patient, first column, position of therapist, second column, procedure, third column. Again, drawing diagrams in goniometry again gets clumsy. So let's not create that. Draw a goniometer first only and write about how you will be, about the stable arm and the mobile arm, about the fulcrum, axis, joint axis and all. That will fetch more marks. Just a minute. So here I am telling first column. First column goes for movement. Here you will be writing about the movement. For example, it is hip flexion. If you want to mention with hip flexion, with knee flexion separately, with knee extension separately, mention. If not directly hip flexion, you can directly write 90 to 120. And here write about where the fulcrum should be placed. So if I'm talking about hip flexion and extension, fulcrum is placed at one place, just 2 inches below the ASIS. For hip abduction and adduction, again you will be going for hip abduction 30 degrees, and I'm sorry, for hip adduction and abduction the fulcrum is 2 inches below the ASIS. You will be mentioning that. And for medial and lateral rotation, you will be talking about the patella. So goniometer is again a lengthy topic, but again, if there is no time, instead of writing hip flexion separately, hip extension separately, write hip flexion and extension. Next comes hip adduction and abduction. Next, hip medial rotation and lateral rotation. Only the direction changes. The movement also changes. The ROM also changes. Only thing I want there is, in places where in goniometer, and there was 1 second. There was one more answer, relaxation. In answers like goniometer and relaxation, where in answers like goniometer and relaxation, where ray diagrams will not be suitable, there you can directly start with tabular form. That will be helping you to write in a perfect order and will be helping to correct everything. You will be not missing anything when you choose tabular form for answers like relaxation and goniometer. For re-education, also you can consider the same thing. As I said, for grade 0 to 1, 1 to 2, 2 to 3, 3 to 4, 4 to 5, there directly go for tabular form. But for suspension therapy, equipments at least you need to draw diagram. This is about essay questions. Now coming to short notes. In this paper, there are again, the pattern is same. I'll first read out the questions. Determinants of gait, PNF techniques for facilitation, explain the muscle work in standing position, group action of muscles, coordination, indications and contraindications of hydrotherapy, physiological effects of exercise, Hubbard time. I guess the paper setter wants to give more weightage for hydrotherapy. So he added hydrotherapy, again Hubbard tank as well. So one advantage the student will be having if same question comes. That is indications, contraindications of hydrotherapy and Hubbard tank. So these two make 10 marks question again. 5 marks for hydrotherapy, 5 marks for Hubbard tank. Start for hydrotherapy again with 5 marks. In 5 marks, you'll be start writing about the definition. You'll be writing about all the principles before writing about indications and contraindications. Buoyancy, you'll be writing about the buoyancy, you'll be writing about surface tension, and you will be always again writing about the turbulent flow. So these three will add some weightage along with indications and contraindications. And even if the question is asked for 2 marks also about hydrotherapy, a sentence, just write a sentence that the best equipment used for hydrotherapy is Hubbard tank. So this will give an idea for the examiner that, okay, the students know something about it. Even for 2 marks question, writing a simple sentence will add more weightage. Coming to Hubbard tank, you people already know the measurements. You will be drawing that first and writing the measurements. Again, writing indications, contraindications of hydrotherapy. Here, again, there's no need for you people to mention about all the principles of hydrotherapy or aquatic therapy. Simply draw the diagram, give indications, contraindications, describe about Hubbard tank. Coming to determinants of gait. Gait and posture in exercise therapy and biomechanics, you will be having questions more similar types. So once you read for biomechanics, make sure you're reading it for exercise therapy as well. In this paper, determinants of gait is asked, but that doesn't mean the other parts of the gait won't be asked. You will be even asked about a few measurements of gait as well. If the examiner thinks that my students this time the batch is very good, and if he wants to add questions like how cadence can be changed, or give me a or describe in detail about the changes in so and so gait, the changes of all the determinants in antalgic gait or Trendelenburg sign gait. So here the question is actually of two different types. So whenever you're reading about the gait, read about abnormal gaits as well. Here in determinants of gait, write about the phases as well, both the stance phase. When you will be writing about both the stance phase and swing phase in the determinants of the gait, it will be, there is a diagram in Sindhi and Orkin for both stance phase and swing phase. Once that is written, write about the determinants of gait. In all the, you have got all 6 determinants of gait. If you are not able to remember all 6, minimum 4 are necessary. PNF techniques, PNF mostly will be asked for long answer question as well, essay question also. So even though you are writing about PNF, However, only writing patterns is not the answer for PNF. Mostly it has been misunderstood that PNF is pattern. Most of the physios remember all D1, D2 flexion, extension of upper limb, lower limb as the pattern, those patterns as answer for PNF. First, the answer should be started by basic procedures of facilitation, at least by mentioning. Mentioning all these will be giving an advantage. Second is, again, the PNF techniques and their goals. Rhythmic initiation, combination of isotonics, stabilizing reversals, rhythmic stabilization, repeated stretch, contract, relax, hold, relax. So these are the other techniques you will be talking about. If you don't know all these techniques, first write about the procedures. Only mentioning that will, I have actually mentioned the entire answer. PNF, basic procedures, and techniques and their goals. Once this is all mentioned, you can write whatever you want depending on that particular side heading. If you are not mentioning this and if you are writing only D1, D2 flexion, you will be getting half of the marks irrespective of how much ever it has been given. If the PNF is asked for 10 marks and if you are writing only about the patterns, you will be getting hardly 2 to 3 marks. But if you are writing this in this format, you will be fetching almost 8 by 10. After hold, relax, if you want to write patterns hardly carry like 1 to 2 marks in the entire PNF. As it is asked for short answer, and the question here is facilitation. So for facilitation, the techniques used for facilitation will be rhythmic initiation, combination of isotonics, rhythmic stabilization, contract, relax, hold, relax. So almost all techniques comes under, most of the techniques comes under facilitation only. So once that is done, you can talk about patterns. In patterns also you will be talking about facilitation only. This is how PNF answer should be attempted. But if you feel that you don't know anything and you have not read anything about PNF, you don't know all these terms which I am mentioning here, learning patterns is okay. Again, remember, before writing all this, before writing only the patterns, I want you people to at least mention about verbal stimulation, vision, timing, body position and body mechanics. Last is manual contact. Not all procedures are necessary again to be written in the exam. Manual contact, body position and body mechanics, verbal stimulation, nothing but commands, vision and timing plus patterns. In this, if you mention this procedure for any PNF answer, even if it is asked for 2 marks, 5 marks, 10 marks, it will be giving you a good score. Techniques, I can't compromise with the techniques because I actually love PNF more than any other technique. So if you feel like you don't know all the techniques, for the safer side, contract, relax, hold, relax are the easiest techniques to be learned. So contract, relax is you'll ask the patient to contract and relax. For hold, relax, you'll ask the patient to hold that contraction for particular time and then relax. Now, apart from hold, relax and contract, relax, the other technique that is a bit easier is rhythmic initiation. In the entire exercise therapy, you will be learning how we will be making a patient who is just doing passive movements to resisted movement. So this range is nothing but entire rhythmic initiation. These 3 techniques are easier to learn, but all the techniques are necessary to be kept on the paper. The other question is muscle work in standing position. So there are derived positions and there are starting positions and derived positions. In all 5 starting positions, if you just learn about only one standing position, you can actually write about the entire all different 5 positions. So standing, how the patient will be standing or how you will make the patient to stand, that will be depending on first, you will be talking about the entire anatomical position, standing in entire anatomical positions with feet shoulder width apart, palm facing the anterior aspect, patient looking at the horizon, This is considered as the anatomical position or standing position. Here, muscle work is nothing but just give 2 minutes time for yourself. Stand. When you are standing, which muscle is contracting eccentrically, which muscle is contracting concentrically. This will be giving you idea of how how muscle work is done. Once this is done, open Dina Gardner and learn about the muscle work. It is much easier. Here, it's all about which muscle is trying to maintain the neutralization. For example, as you can see, only the upper back of me. Yes. To maintain my neck in neutral position, my flexors are acting, my extensors are acting, my rotators are also acting. So here, as they are acting this much, what I can do, I can talk about which is contracting eccentrically, which is contracting concentrically. My neck flexors will be contracting concentrically, whereas my neck extensors will be contracting eccentrically, trying to hold the neck in the position where it is not falling like this. My neck flexors are trying to maintain this position where my neck is not going like this. Same thing apply for each and every joint. So explaining the muscle work in standing position here, once you only learn about standing position, you can write about all 4 techniques. In few question papers, they will be asking write about all the derived positions as well. So here I'm just giving a gist of how a paper should be presented. If you want more detail, in Prakara website, you will be having the exam module sessions as well. You can subscribe for it. It will be easier for you people to even understand how easily you can present a paper. Now coming to explain group actions of muscles. For this answer, you can write too many things, but the correct answer here will be first writing about the muscle contraction. How the muscle is contracting. Isometric contraction, eccentric contraction, and concentric contraction. Once this is done, you will be again talking about 3 different terms. Agonist, antagonist, synergist. Once these 3 are done, you will talk about individual joint muscle, multiple joint muscle. If still you have time and if you're confident on the topic of inefficiencies, active inefficiencies and passive insufficiencies, you can directly write at the group action of the muscle. If you want to write examples, you can write. Few people think only writing about the contraction of the muscle will work. No, it's about entire mechanics of how you will be describing a particular position. So when I'm talking about the concentric muscle, or drawing a sarcomere is easier. Draw a sarcomere, concentric contraction, shortening, eccentric contraction, lengthening, isometric contraction, same. So once you draw it, you talk about agonist, antagonist, and synergist. Best example is elbow flexion. So biceps brachii will be considered as agonist, triceps will be considered as antagonist, brachialis is considered as synergist. So for elbow flexion. So once this is done, you can even talk about how biceps is affecting both shoulder and elbow. Biceps is a shoulder flexor, shoulder medial rotator, and elbow flexor as well. So when you are mentioning about this, it becomes a bit easier with single example. If you don't want to write biceps as an example, second example will be hamstrings. Once that is done, write about a muscle working at an individual joint and multiple joint as well. Next comes coordination. Exercises for coordination, there are for 5 marks answer, mentioning it will be enough. If you want, you can simply mention about the exercises and it will be done. But if you want to fetch 5 by 5, directly draw exercise and mention about that particular part. For example, if you're talking only about Frankel's exercises for coordination is different. Frankel's exercise is a part of coordination. For exercises of coordination, only writing Frankel's will not fetch you marks. It will give only 1 by 5 or 2 by 5. For exercises of coordination, you need to write the entire list. Indications and contraindications were already discussed, and next is Hubbard time. Here, next comes physiological effects of exercise. So when I'm talking about physiological effects of exercise, before going in detail here, this answer is kind of like general question. Exercise is different, physical activity is different, work is different. So you going to college sitting, that is considered as work. If you are going to college by walk, even if it is something around 2 kilometers you are walking, that is considered as physical activity. But exercise is something where you actually remove some time, do physical exertion work where your muscles are contracting, you are sweating, your heart is pumping too much of blood, all these actions are taking place, then it is exercise. So before starting any answer in which is in general like this, I would prefer writing about exercise, physical activity, and work, the difference between all these three, and then mentioning about the physiological effects. So here physiological effects, simply keeping, if I stick to the basics, first I'll talk about the thermal regulation that happens in my body. Then secondarily, I'll talk about how my heart is pumping the blood. Third, I'll talk about how lungs are able to go for taking more and more oxygen just to stop me from getting lactic acid accumulation. Fourth, I'll be talking about the muscle contraction. Fifth, I'll be talking about muscle regeneration. So these are enough for physiological effects of exercise. This is about short notes. In SAQs, long answer questions and short answer questions, one thing that will have a good impression, and I recommend everyone to make this as a habit, is writing the references. For example, you write the entire determinant of gates. At the end of the answer, reference, colon, you will be writing Cynthia Norkins and the basics of biomechanics. Or for PNF, techniques of facilitation, you will be writing Adler's PNF. Simply don't write the author's name and leave. You need to write the book name and the author name. Reference, writing reference will give, is a very good habit, and I'll advise you to start this habit from today. Whenever you're writing answer in any other subjects as well, even if you're going for biochemistry also, write about the book you are reading, whatever book you are preferring. Physiology, anatomy, HF, LF, any book, Clayton you are talking about, just write about reference, the name of the book, and the author name. Even if you are missing the author name, that is okay, but simply don't write the author name and leave. Coming to VSAQs, reference is generally not required in VSAQs or brief notes. Complications of bed rest. You can write n number of answers here. Any answer is considered to be correct. Bed sore is the one which we talk more. So once you start writing about the bed sore, you can write about the other things as well, like decrease in the muscle activity, the changes in the skin you will be seeing and all. Coming to lower limb measurement, limb length measurement. Here you have to write with shoes on, with shoes off, and standing and supine. And different methods of gait training. Here you will be talking about step training, ramp walking, parallel bar training, feedback training, and you will be even talking about, you can even talk about gait training in water as well. First order, second order lever, and examples in the human body. Very easy question. Indications and contraindications of passive movements. Again, I told any question like this asked, and if you are not remembering anything, simply remember indications and contraindications of exercise therapy overall and write for this particular answer. Next, breathing exercises. Breathing exercises, first thing I want you people to mention here is about relaxation. You will be writing one sentence regarding relaxation. Then you can talk about diaphragmatic exercises. The other set of questions here, springs in series and springs in parallel, directly draw diagram. You already know how series is set and how parallel is set. Pulleys also you can start. Here, as it is not biomechanics paper, it is exercise therapy paper. In pulleys, most of the time, the exercise therapy pulleys is about the actual physics part of the pulley, where how the pulley is mentioned, what is the physics behind that particular pulley. If you want, you can write about anatomical pulley or as well. But as I told you, even if your answer is wrong, but if you have attempted it, even 0.5 marks will be allotted. Last is Hooke's law. So when you're learning about Hooke's law, learn about Newton's laws as well. This is how a paper should be presented. The way I explained how to write all these answers and the way I presented my PPT is very much different. So whenever an examiner is correcting the paper, if the paper looks this boring, he will not read any of your answers and he just gives generalized marks for your particular answer or session, answers or entire paper if considered. Hence, I am mentioning about ray diagrams, tabular forms, drawings, or don't use nowadays there is authority or there is right that you can use color pens as well. Don't use the official colors red, green, and pink. And that's all, we are done for the session. If you want to know more about the exam paper modules and all, in Prakara, you will be having exam module sessions directly. You can subscribe for that. Thank you and all the best, everyone.